The Practice of Awareness, a comprehensive report on meditation. Executive summary. This report provides a definitive and accessible overview of meditation, synthesizing its ancient origins with contemporary scientific understanding. The practice is defined not as an esoteric or spiritual escape from reality, but as a systematic method for training the mind. By deliberately focusing or clearing the mind using a combination of mental and physical techniques, individuals can cultivate an enhanced sense of present-moment awareness, leading to greater peace and inner harmony. The report explores meditation's deep historical roots, its pivotal evolution into a secular health practice, and the spectrum of its diverse forms. It meticulously reviews the extensive body of scientific evidence supporting its profound benefits for psychological, cognitive, and physical health. Crucially, it clarifies common misconceptions that often deter newcomers and provides a practical guide for beginning a personal practice. The findings presented demonstrate that meditation is a verifiable, skill-based discipline with the capacity to foster resilience, regulate emotional states, and measurably alter brain function, offering a powerful tool for well-being in the modern world. 1. What is meditation? An accessible and definitive introduction. Meditation is a practice that involves a deliberate act of focusing or clearing the mind through mental and physical techniques. Contrary to the popular misconception that the goal is to empty the mind of all thoughts, the true purpose is to cultivate a heightened state of awareness of the present moment. While a deep sense of relaxation is a common and welcome side effect, it is not the primary objective of the practice. Instead, meditation is a form of mental training, a disciplined exercise that builds the muscle of attention and mindfulness. The fundamental principle of meditation is the acknowledgement that the mind will inevitably wander. This is not a failure, it is a natural function of the brain. The skill being developed is the gentle, non-judgmental act of noticing when the mind has drifted and then calmly redirecting its focus back to a chosen anchor. This anchor can be the sensation of the breath, a sound, or a bodily feeling. The practice is about observing the flow of thoughts without becoming entangled in them, much like watching clouds pass in the sky. This process is a direct counterpoint to the idea of trying to suppress thoughts, which can be an ineffective and even counterproductive endeavor. By learning to observe rather than react to one's internal landscape, individuals gain a greater sense of emotional regulation, focus, and inner calm. This is the essence of meditation, a systematic cultivation of awareness and attention. 2. A journey through time, the history and evolution of meditation. The practice of meditation has a deep and pervasive history, with evidence dating back to as early as 5000 BCE. Archaeologists have uncovered cave drawings that suggest early shamanistic meditation for healing, while ancient Hindu scriptures known as the Tantras also document the practice from approximately 5,000 years ago. Over millennia, meditation has been at the core of various religious and philosophical traditions, including Hinduism, Buddhism, Jainism, Sikhism, and Judaism, as well as in ancient Egypt and China. In ancient India, the Sanskrit term dhyana, meaning contemplation and profound abstract meditation, became central to the yoga process, which aims for a yogi to realize their true self and connection with the ultimate reality. Meditation's global spread began along the Silk Road around 5 to 6 centuries BCE, gradually transforming and adapting to the cultural contexts it entered. This dynamic evolution demonstrates that meditation has never been a monolithic practice, but rather a diverse and adaptable one. The most pivotal shift in its history occurred in the 20th century, when it began to move beyond its specific religious origins and into the mainstream, particularly in the West. This transition was not a single, spontaneous event, but the result of two distinct forces converging to redefine the practice for a wider audience. The first was the advent of rigorous scientific inquiry into its physiological effects. Researchers in the 1960s, such as B.K. Anand in India and Dr. Herbert Benson at Harvard Medical School, conducted studies that provided a biological explanation for the practice. Benson's 1967 study, for example, found that meditators used 17% less oxygen, had lower heart rates, and produced increased brain waves associated with sleep. Concurrently, the second force, celebrity endorsement, provided the mass market appeal needed to propel meditation into public consciousness. In the 1960s and 1970s, High-profile figures like the Beatles and Mia Farrow popularized transcendental meditation, TM, bringing attention to the scientific research that was emerging at the same time. This powerful synthesis of scientific legitimacy and cultural cachet allowed meditation to shed its hippie connotations by the 1990s and solidify its place as a health-focused, Hollywood-friendly concept. 3. The Spectrum of Practices, a guide to major meditation types. Meditation is not a single practice, but a wide spectrum of techniques and approaches. While they all aim to train the mind, they do so through different methods and for different purposes. Mindfulness meditation. This is the most popular and extensively researched form of meditation in the West, with its origins in Buddhist teachings. The practice involves paying attention to thoughts, feelings, and bodily sensations as they arise without judgment. It is an exercise in combining concentration with awareness, often by using the breath or a physical sensation as a focal point to anchor the mind while observing other internal and external phenomena. Focused meditation. This technique trains the mind to focus on one single thing, intentionally ignoring all distractions. The chosen anchor can be an internal one, such as the breath, or an external object like a candle flame, a mantra, or a visual image. The process involves gently returning the mind to the object of focus each time it wanders, building a powerful sense of concentration and mental clarity. Loving-kindness meditation, metta. Also known as metta, this practice originates from Buddhist traditions and is centered on cultivating compassion and empathy. It involves silently or aloud repeating kind phrases such as, "May I be happy," "May I be healthy," and "May I live with ease." The practice is often structured in a graded way, starting with directing these positive wishes toward oneself, then expanding the circle of compassion to loved ones, neutral individuals, and eventually to all living beings, even those one may not like. The goal is to replace negative feelings with kindness, ultimately leading to greater emotional resilience and improved relationships. Transcendental meditation, TM. A form of meditation with roots in ancient Hindu traditions. TM became widely known in the West in the mid-20th century. The technique involves using a mantra, a specific phrase or sound, that is repeated silently or aloud to achieve a state of relaxed awareness. Unlike other forms of focused meditation, practitioners are encouraged to let their minds drift until they quiet naturally, while the body remains alert. Spiritual meditation. This type of meditation is practiced across a wide range of religions and spiritual traditions, from Christian contemplative prayer to Sufi dhikr. The purpose is to deepen one's understanding of spiritual meaning and connection with a higher power or spiritual force. Techniques often include silent prayer, chants, or the use of religious items like prayer beads. Other forms of meditation, such as movement meditation like yoga, walking meditation, and body-centered meditation, body scans, further demonstrate the breadth of this practice. The diversity of available techniques allows individuals to choose a method that best aligns with their goals and lifestyle. 4. The proven benefits, a comprehensive review of the evidence. The growing body of scientific literature provides robust evidence that meditation yields significant psychological, cognitive, and physical benefits, moving it firmly from a spiritual discipline to a validated health intervention. Meditation is widely recognized for its profound effects on psychological and emotional well-being. Numerous studies have shown that it can effectively reduce stress and anxiety, even in high-pressure environments. A systematic review of over 100 randomized controlled trials, RCTs, found that meditation practices, particularly mindfulness-based and yoga-based interventions, show a high ratio of positive outcomes for symptoms of stress, anxiety, and depression. One of the most compelling pieces of evidence for its therapeutic efficacy comes from a landmark 2022 clinical trial. This first-of-its-kind randomized study found that a guided mindfulness-based stress reduction (MBSR) program was as effective as the common antidepressant drug escitalopram for treating anxiety disorders. The findings demonstrated a statistically equivalent reduction in anxiety symptoms for both groups, indicating that meditation is not merely a complementary therapy, but a viable, evidence-based alternative for certain conditions. It is important to note, however, that the study's researchers also observed that the practice requires a consistent investment of time and effort to achieve these results. The practice also delivers significant cognitive enhancements. It has been shown to improve attention span, concentration, and focus. One study even found that just 4 days of meditation, was enough to enhance a participant's attention span. A review of 12 different studies on older adults revealed that multiple types of meditation increase memory, attention, and mental quickness, and can even partially improve the memory of dementia patients. In the workplace, meditation has been shown to boost productivity, creativity, and problem-solving skills, while also improving work satisfaction and reducing burnout. Finally, the physiological benefits of meditation are substantial and well documented. It has been proven to help control pain perception, with one fMRI study showing a 45% reduction in pain reports after a short training period. Participants who meditated in other studies showed enhanced activity in the brain centers that control pain and reported less chronic or intermittent pain. Additionally, meditation can lower blood pressure and reduce strain on the heart, leading to improved cardiovascular health. For sleep, a systematic review of RCTs showed that meditation produced positive outcomes for sleep quality in over 70% of the assessed trials, reducing the time it takes to fall asleep. 5. The neurological landscape: how meditation changes the brain. The significant benefits of meditation are not merely psychological. They are a direct consequence of the practice's ability to alter the physical and functional architecture of the brain. Meditation has been shown to change brain waves, which helps people to relax, concentrate, and process information more effectively. A groundbreaking 2025 study from the Icahn School of Medicine at Mount Sinai provided a deeper understanding of this process by using advanced invasive EEG recordings from deep within the brain. Researchers found that loving-kindness meditation led to measurable changes in the activity of the amygdala and hippocampus, two key brain regions involved in emotional regulation and memory. Specifically, the study noted that the practice was associated with changes in the strength and duration of beta and gamma brainwaves. The significance of this finding is profound, as these brainwaves are known to be affected in mood disorders such as anxiety and depression. This suggests a direct physiological mechanism by which meditation can improve emotional well-being and explains the correlation between meditation and psychological benefits, such as stress reduction and emotional regulation. For example, the stress reduction and emotional regulation reported by meditators is a direct result of changes in the amygdala, the brain's primary fear center. Similarly, the improved memory and attention skills are a direct consequence of the practice's effect on the hippocampus, and the slowing of the thinning of the prefrontal cortex, a change associated with healthy aging. This clear cause-and-effect relationship between mental practice and tangible neurological change is fundamental to validating meditation as a powerful science-backed tool for well-being. 6. Debunking the myths, separating fact from fiction. Meditation has been the subject of numerous misconceptions that often prevent individuals from exploring its benefits. Separating these myths from the documented reality is essential for a true understanding of the practice. 7. A practical guide to starting your practice. Beginning a meditation practice can feel daunting, but it is a skill that gets easier with time and consistency, much like learning to run. A simple step-by-step approach can help establish a sustainable routine. The first step is to set a goal. An individual should consider their motivation. Is it to reduce daily stress, improve sleep, or enhance focus at work? Establishing a clear purpose can help maintain motivation, especially when challenges arise. Next, it is important to find a comfortable and stable position. This does not require becoming a human pretzel in a cross-legged pose. Sitting upright in a chair with feet on the floor or even reclining is perfectly acceptable as long as the position feels comfortable and allows for a relaxed body without tension. A quiet, comfortable spot free from distractions can help facilitate focus, though the practice can be adapted to any environment. For beginners, starting with a short duration is key. As little as 5 to 10 minutes a day is enough to begin, and the duration can be gradually increased as the practice becomes easier. Setting a timer can prevent the mind from worrying about the clock. The most common and effective technique for beginners is mindful breathing. The process is simple. Close the eyes and gently focus attention on the sensation of the breath as it enters and leaves the body, without trying to control its pace. The breath serves as the anchor for the mind. The most significant challenge for a beginner is the wandering mind. However, this is a core part of the practice, not a sign of failure. The moment an individual notices their mind has become distracted by a thought or sensation is, in fact, a moment of mindfulness. The true work of meditation lies in the repeated, gentle act of noticing the distraction and without judgment, kindly returning the attention to the anchor of the breath. This reframing of a challenge into a success is critical for building a sustainable practice. To get started, guided meditations, available on numerous apps and online, can provide valuable structure and support for newcomers. Conclusion: the lifelong practice of awareness. Meditation is a skill-based practice with a rich and diverse history, spanning millennia of human culture and spirituality. The contemporary era has seen it evolve into a secular, evidence-based tool for health and well-being, validated by a growing body of scientific research. It is not an escape from reality or a magical cure, but a powerful discipline for training the mind to cultivate awareness, build emotional resilience, and enhance cognitive function. The findings presented in this report, from the groundbreaking clinical trials on anxiety to the neurological studies on brainwave activity, unequivocally demonstrate that meditation can lead to measurable and lasting positive change. By shedding common misconceptions and approaching the practice with patience and a clear intention, individuals can integrate this profound discipline into their lives. The journey of meditation is a lifelong practice of gentle self-discovery, offering a sustainable path to peace and inner harmony in an increasingly complex world.